Last week we talked about evolving the orders in regard to visitation for nursing homes as well as assisted living facilities. Today I want to go over the specifics of what we've included in that updated health director's order. As we talked about before, assisted living facilities need to follow the Ohio order, but nursing homes need to follow the Ohio order plus the federal regulations from the Centers for Medicare and Medicaid Services, known as CMS. So we have worked hard to align the Ohio orders with the federal guidance for nursing homes to keep it clear, make it simple, and to encourage visitation. So the following is general visitation requirements for both nursing homes and assisted living. The general visitations remain the same. Visitors need to be screened for COVID-19 symptoms at the front door. There needs to be a visitor log in case we need to do contact tracing later. 3, visitors are required to wear masks, wash their hands, and the home needs to keep up with cleaning and sanitizing. And 4, visits need to be scheduled in advance. Here are the changes, the big changes to support visitation in a safe way. And again, these are for nursing homes as well as for assisted living. Previously, visitation was permitted, not required. Now, this is a change. We are requiring the nursing homes and assisted living to have visitation. Whenever the circumstances are met, the criteria is met. Second, we are allowing vaccinated residents to have physical touch with their visitors while wearing a mask. Previously, being able to hug someone was certainly discouraged. That has been changed. 3, we're permitting visitation in a resident's private room. Again, this is both in assisted living and in nursing homes. Previously, there had to be a separate visitation area. That no longer is true. We are setting 30 minutes as the minimum amount of time for the visit. Minimum. In other words, we're telling the nursing homes and the assisted living, someone comes to visit, you have to allow them at least 30 minutes. Next, we are expanding the list of examples when compassionate care visits should be granted. You'll be able to find those on the web page. Previously, the list had 4 instances. Now it has 9 examples of compassionate visitation. The orders that we're issuing also are updating what testing is required in the nursing homes and in the assisted living facilities. Although many of the residents are vaccinated, we think roughly 90%, and everyone who wanted the vaccination has received one. We need to continue regularly testing for the virus. It's good science, and it will help us identify cases early, and it will help us prevent the spread. As we talked about last week, the spread has gone down just dramatically. Further, if COVID is controlled, that means less disruption to visitation. We'll be asking nursing homes and assisted living to test vaccinated staff once per week. So if you are a staff member and you work in a nursing home or assisted living, you'll be tested once per week if you have been vaccinated. However, unvaccinated staff, those who have not been vaccinated, that will be 2 times a week. So that will be the difference. And again, we will continue to offer staff members, as we are any unvaccinated residents, the opportunity to be vaccinated. We will continue to offer them that. So again, to repeat, we'll be asking homes to test vaccinated staff once per week and unvaccinated staff twice per week. We should note that there are still some times when visitation will be restricted, as if there's an outbreak throughout the facility. So it's still very important for facilities to report into the visitation dashboard and know their county positivity rate. The dashboard is available on coronavirus.ohio.gov, so anyone will have the opportunity to take a look at that.